and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Did I
therapist.
catch you off guard?
Yeah.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Napoleon has lost a leg, Brad. How
Oh.
sad. Napoleon Bonaparte. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, and pain-free, and we upload every day.
There you go.
Let's get into today's topic, Brad. We're talking about hip impingement, the causes. We're going to show you a test you can do, the treatment. But I want to say right here at the outset, Brad, that I think a lot of people are misdiagnosing this, especially young people. They think they have hip impingement, which is actually femoral acetabular syndrome.
Oh, now we're getting into the big words.
But well, as we move along here, you'll see the difference.
Sure.
So at the end of the video, I'm going to talk about what I think most people have, which is more of a rectus femoris tendinitis. So again, big words, but I'm going to show you there's different ways to treat these. These are completely different things.
You may call it hip flexor tendinitis.
Hip flexor tendinitis, right. But it's not hip impingement. So, all right, what is hip impingement or femoral acetabular impingement? First off, let's talk about how this develops, Brad.
Yep. You want me to hold his arm?
Yeah, hold his arm.
Shall we dance?
If you are somewhat bow-legged.
Here, let's get this. There we go.
Yeah, I'm going to put this in here actually, Brad.
Yep.
Now, instead of the forces normally going up right into the hip where they normally do, now the forces are going to, because they're like this, the force is going to come out up here and it's going to hit the outside of the hip. And
so it just puts it at an abnormal alignment.
Right.
So,
and if that abnormal forces go on for year after year after year, what does the bone do? The bone reacts, doesn't it?
right, it's going to calcify in that area to help make it stronger, which builds up. Kind of like the way a bone spur will, but this is not a bone spur. It's
right.
A similar concept.
It's Wolff's law. Bone, when it gets forces on it, it actually gets stronger or bigger or it reacts to it.
Right. It's really part of the growing process in the normal human body, but this is just an anomaly of it.
So what happens? We're going to get a little closer, Lonnie. Now, don't get frightened.
Oh yeah.
So one of two things, or one of three things, can happen with this, Brad and Lonnie. Can you see this okay, Lonnie? All right. This is the acetabulum, or the socket for the hip. Here's the hip bone itself, the round part of it. And normally, again, it fits in here and just smoothly glides like this. But again, if you start getting forces on the outside of the hip here,
yeah, right in through here,
you're going to get an extra bone growing here. And why is that a problem? Well, you have also a socket here, a seal that they call the labrum. It helps hold the hip in. You see that orange? And if this bone grows out too far, when this bone comes up in there, it can actually pinch it and it can actually destroy it after a while.
Right. So the labrum is actually kind of like a cartilage more material.
Right.
Would you say? And if we start to pinch it and deform it, it's going to cause problems and pain, and it's not good.
Right. And that's why quite often, I would say femoral acetabular syndrome is not a problem, Brad, unless it starts to destroy something.
Sure.
If it destroys the labrum, or if it destroys the surface, the cartilage that's on top of that articular cartilage on top of the
on the
bone.
ball of the femur.
So it can grow here. It can also grow right here, Brad. It can form right here and form a big bump right here.
So it can either be on the ball or on the pelvis area.
Right. So either one is a bony thing that you can't change.
Sure. You're not going to exercise it away.
Right. And I've seen some other YouTube videos where people were taking bands and stuff like that and doing looks like they were doing MOBs with this. And I just don't know how that's going to change bone.
Sure.
So again, if they do an x-ray and they find this on you and you're pain-free, there's absolutely no reason to do anything about it.
Right, and I don't think the orthopedic doctor is going to say, you've got this problem, we're going to do surgery if there's no symptoms and no pain. It's just like your body adjusted to it.
Right. It's again, a pincher and a cam is what they call the two names. Pincher meaning it pinches probably,
sure.
Right? So, and if you do have a torn labrum, that's going to be between you and your surgeon whether or not you're going to repair that or not.
Sure.
But the first thing that you might try is some therapy, and you say, well, therapy doesn't help. Well, it can help calm things down.
Sure.
The first thing I would suggest, Brad, is that just take some weight off the area. Let's see if we can maybe it's a little inflamed. Let's see if we can get it to calm down. So just use a cane.
Sure.
You got a cane, Brad?
Oh, sure. Yeah, so if walking is an irritant and it clearly irritates it every time you put weight through that side, get the cane out, use it on the opposite arm, and walk with the cane. That's going to unload and take pressure off that irritated area, giving it a chance.
That's a good point, Brad. A lot of people aren't going to understand that, but and we don't have the time right now to explain biomechanically why that works, but it's better to have the cane on the opposite hand of the painful hip.
Right.
And you want to show the proper height for a cane, Brad?
Sure. If you're standing here, let your arm hang down. When you put the cane here, the handle should come right to the wrist crease, right there. If it's down here, it's too low. If it's up here, it's too high. You know, make your adjustments. Usually aluminum canes are easy to adjust. If it's a wooden cane, you can cut it shorter, but you can't cut it on. So.
All right. Yeah, thanks, Brad. The other thing you may want to try is some of the NSAIDs, non-steroidal, anti-inflammatory drugs.
Ibuprofen is
ibuprofen. And we actually have a video on how you might try to dose that, don't we?
Sure, yep, nice one.
The other thing is you want to make sure you are keeping as much range of motion in the hip as possible. You know, a simple one that we do, Brad, is we have people lay down and if I'm working this hip, you know, you can work into flexion this way, flexion, extension, and you can do rotations this way too, Brad.
Yep.
I got tissues falling out of my pocket, Brad. Yeah. Making me cry.
So again, with these exercises, they shouldn't irritate it. There may be a little stretch involved, maybe a little irritation, but the more you do it, it should feel better. So if it hurts and it starts getting worse as you do more, you're aggravating it and you need to stop.
Yeah, and the other thing is with pain, I'm staying in this position for a reason, Brad. I'm not just trying to look stupid. With pain, quite often the muscles start to get weak, and that throws things off even more. Wouldn't you say, Brad? You know.
Sure, right.
So it wouldn't hurt to strengthen that hip either.
Sure.
And one easy one to do is what we call four ways.
Okay.
So you just lay on your side. I'm going to strengthen this one. I'm putting this one bent just to kind of give me a little bit of a base. And you can start doing hip abduction. And I'm keeping the toe straight forward, aren't I, Brad? I'm not going this way.
Don't point it up.
Or I'm not going that way.
Straight ahead. So we're working this hip abductor muscle right in here.
Okay. And then I can go onto my back and I can do hip flexion.
Why don't you
do it on this
legs?
one?
Yeah.
Switch.
So it's really good idea to keep this knee up like here. Gives your back and your pelvis some support. It's easier to do.
We can do hip adduction. So I'm going up like this now, and I'm strengthening the inside of the hip here.
Sure.
Same thing now. I don't turn the foot up. I don't turn the foot down. I keep it right in the middle.
Yep. This one's a kind of awkward to do.
It is an awkward one. Still good to do though, Brad.
Sure, you bet.
And then you can do hip extension. So you're just going to work on lifting up like that.
You notice how Bob keeps his leg nice and straight, works out better that way. That really works that posterior hip well.
So now, really, we're going to talk about now rectus femoris tendinitis, Brad, and that's where we think a lot of times people are having trouble. You have a muscle here that comes down off the pelvis here and off the ASIS, and it goes down and attaches into the femur, and there's a tendon there, and that one is, if you are laying, why don't you lay down, Brad, once flat. I'll give you a pillow.
Yeah, please. A pillow.
So if you're tender when you go like this, and it
Need a chest.
Ow,
it pinches.
Yeah, it pinches. That's more likely to be due to a femoral, the rectus femoris.
Right.
Now, if it's acetabular syndrome, Brad, what we do is we go into flexion, a little bit of abduction, and then internal rotation like this.
Right. That's kind of hard to see because Bob's in the way.
So we'll do it again. I'm bending it, I'm bringing it towards the other leg a little bit, and now I'm bringing the ankle out. I'm turning the leg.
Sure.
If that hurts, that tends to be the first thing we were talking about.
The true impingement.
Yeah, the true impingement.
Okay.
If you just go straight up like this, and that pinches,
Yep.
that may be more like, I'm thinking of the rectus femoris, that muscle that may be more of a problem.
Often called hip flexor tendinitis.
Hip flexor
is another
tendinitis.
common name.
If you flip onto your stomach, Brad, and I'm testing this one right here, and I have them pushed down. Just push down this way. Yep. That would be also, if that hurts, that could be the second thing we're talking about. Again, the hip flexor tendinitis.
Sure.
Okay, why don't we sit up, Brad, real quick. I didn't mean that.
I said quick.
So if you want to try, to see if that's actually the problem, generally, if you find the ASIS, the anterior superior
That's that
spine,
bony part.
want to show it on here?
Sure.
So it's right there.
It's right on the belt line.
Yep, you find that it's the biggest bone sticking out there,
Yep,
right?
yep. It's pretty easy to palpate.
Yeah. So you go about 8 centimeters below that, which what is that in inches, Brad? About 2.5?
Right.
About
Yep.
2.5 inches below that, and you rub right there. That's where that tendon is. And if it hurts right there, and it's hurting in that area, that's more likely that you have the hip flexor tendonitis.
Sure. Yeah, because that's quite a distance away from the impingement we're talking about.
Yeah, and that's actually a treatment you can do, Brad. Is you can
Cross-friction
Yeah,
massage?
you can get yourself in a relaxed position, and you can rub that area aggressively
Sure.
for minutes at a time, and that'll help break up that scar tissue and calm it down.
Sure.
So-
And we got a video on that dedicated to that as
Yeah, if
well.
I remember, I'll try to hook that up at the end
Okay,
here. So.
sounds good.
All right, remember, Brad, we can fix just about anything.
Oh yeah, except for,
A broken heart.
there you go. That's pretty good, Bob. You remembered that. You're getting older.